Wikidata.com.
There are so many people who have gone for aligner treatment, and aligner treatment is a very effective treatment, just like orthodontics, if it is done properly, if it is designed properly, and if it is done in the best possible ways, especially Invisalign and things like that. But it's not okay to finish the aligners and then go haywire, because most of the people after they do the aligners, they don't come back at all, because they think that it's okay, their teeth has already come to the position. So, and they don't have a relation just like normal orthodontic treatment, because most of the people wear the aligners at home and they change the aligners at home. They don't go to the dentist very often, so they keep on wearing the aligners, and at the end of the treatment they never go to the orthodontist. So what happens is there is no follow up afterwards. So what are the follow up which has to be planned by the orthodontist, or what is the real follow up or the retention? We have spoken about retention in aligners, but what are the follow up treatments which may require after the aligner treatment? That is what we are talking about. See, first thing is you have to do a follow up in aligner treatment. Even the tracking of the aligners has to be checked by the orthodontist who is doing the aligners, and then once the aligners is kept in the mouth, and once you progress on the aligners, sometimes some of the teeth may not track. That means that one tooth or two teeth may not come as per the design of the aligners. So might have to go for refinements of the aligners. That means that some more aligners has to be given to you, so that the tooth comes to the right position. Why the right position is very important is because then only you will be able to chew. One, second thing is that will give you a better retention of the, see, after some years you might have seen even in orthodontic treatment cases or braces, some of the cases just relapse, some of the cases don't relapse. Why is it? Because there is much better occlusion, the plan is done properly, so that there is no much relapse after the whole treatment. So just like that, even aligner treatment is an orthodontic treatment, so it requires a full planning and movement of teeth into right occlusion. That is one. Second thing is that requires refinement aligners. If it is refinement aligners, sometimes we need to put some elastics, that is, we might have to give some special attachments so that some of the teeth are pulled into the position. That is also in some cases, not in every case. So that might be required. There may be some additional aligners, that is like might need to move some teeth maybe a little bit here and there. So that also might be. All these things are done just after the aligner therapy, that is refinement therapies. Then second thing is we need to see, most of the cases will have especially when you wear more than 3 or 4 months. See, what happens is there will be a gap between the posteriors, that is the back teeth might have a gap. So when you chew, you will not be able to chew the food fully. So that needs to be slowly, the extrusion of the teeth has to happen, and that needs to happen during the retention period. So we need to plan the extrusion of the teeth so that the bite will be proper. Otherwise you will have bite only in the front teeth. So if you have bite in the front teeth, what happens is there are chances that the upper teeth may get flared up. So what we need is, we need a controlled extrusion of the posteriors, or the teeth has to come down. So that also has to be monitored by the orthodontist. So after the aligners, you might have to come 1 or 2 times, so that we will plan and give you what exactly has to be done after the treatment. Now then the retainers, you have to wear the retainers. It is not a magical treatment or anything. So we need to have, either we have to plan for a fixed retainers, that is fixed wire or a fixed glass bonded retainer, which goes on the posterior side, that is on the back side of the teeth. We might stick something so that it doesn't move at all. That is required in some of the cases. In some cases we give a clear retainer itself, so that it just looks like the aligner, but it is a thicker material and it will be able to wear it for more time. Sometimes even the last aligner is used as a retainer. So we will plan accordingly. If you are not available and things like that, we do the last aligner as a retainer. So you will be able to wear that for first for full time, and then maybe we'll change reduce the time, and we might have to taper it down. So all this requires a communication between your orthodontist and the even sometimes with the company, and then we have to plan the follow-up treatments of the aligners to get a perfect occlusion, perfect bite, and perfect treatment results. And if it has to stay where it is, so we might need all these follow-up treatments to be done. Then if you have lost some teeth, we have to correct all those things. If you have spaces between the posteriors, we have to correct that. If there are allied treatments, that is cleaning and checkup and doing all the fillings, that also has to be done at the end of the aligner treatment. So all this requires your acceptance, and then you'll have to come down here so that we will do all the follow-ups. And even after, see, when we do aligners, what we do is we follow up the patient every year so that we will see how the teeth has well settled and how it is retained. So all the retention doesn't end at the end of the aligner treatment. Even with braces, we do that. We have a checkup with them every one year, and so that all these results are sustainable rather than having it for a very short time. So all my cases, all through this 7 or 8 years, they are coming down every year. Once a year they will come up, check up, do a cleaning, and then check up for other problems also, so that they will keep on that beautiful smile and a beautiful bite all through their life. And also that gives us even more confidence that these patients are still having their teeth well aligned. So we are happy to invite you back and do the follow-ups, because we would like to see how they mature in life, and even youngsters or even older people who have done, how they do well in their life even after the aligners, and how beautiful their smile is. So some of the first cases are still coming down here to do a follow-up once a year. So that is what I will advise every patient to do. Go to your dentist, check it up whether the things are correct. If at all you need some adjustments, that also will be done for them. Thank you very much for listening to you. So please do the follow-up for all your aligners, so that you will get a better smile for your life. Thank you.
Wikidentist.com